can a chiropractor relieve the pain from a pinched nerve? Well, it sounds like a disc issue, and we have safe, non-invasive alternatives to surgery for that. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and I'm the board-certified chiropractic orthopedic specialist here in our clinic. And I wanted to tell you about this very common and potentially very painful issue. Are you experiencing shooting pains down into your arms or your legs? If this is the case, well, you may be suffering from a pinched nerve. Not a medical term, but it's a term most people know. Unfortunately, many people will have a pinched nerve at some point in their lives. Although many people feel that surgical operations and surgeries and everything that are required to get this nerve to behave, that's usually not the case. In fact, it's almost always not the case. You almost never need surgery for this stuff. Most of the time, an evidence-based chiropractor can help relieve that pain from a pinched nerve. Now, what exactly is a pinched nerve? Well, why do they occur? And how can a chiropractor assist someone in recovering from a pinched nerve? Well, they occur when there's pressure or compression on a nerve coming out of the spine, which can lead to pain, numbness, and weakness and tingling. Lots of things can cause this. Things like a herniated disc or spinal stenosis or nerve entrapments. That's just naming a few. And this pain doesn't quickly disappear either. It can be painful and difficult to live with and sometimes lead to paralysis even in the most extreme of cases. The most common areas where a pinched nerve can occur are the neck, shoulder, elbow, wrist, low back, all the way down into the legs and feet. The first step in treating a pinched nerve is identifying the cause of the compression. A skilled orthopedic specialist will perform a thorough examination, including an orthopedic and neurological examination, range of motion testing, and movement-related testing to determine the source of the problem. Sometimes you need an MRI, sometimes not. Most of the times you don't. Once the issue is identified, the chiropractor can then begin to develop a treatment plan. Well, this may include non-surgical spinal decompression, which we augment with cold laser, also known as low-level laser, so decompression and laser. Soft therapy, spinal manipulative therapy, popping the bones, right? Moving the bones. And then very specific and very targeted exercises proven to be effective for these types of conditions. Non-surgical spinal decompression augmented with low-level laser is a game changer for those with herniated disc pain. It's the gold standard right here in our clinic for these patients, and it can make an incredible difference for them. In short, spinal decompression is controlled axial traction that can help take pressure off of the discs in an attempt to rehydrate them, reduce the herniation, reduce the inflammation and irritation of the compressed nerve, and encourage healing, blood flow, and pain regulation. It's outstanding for disc patients. Next, adjustments to the spine, also known as spinal manipulative therapy, involve applying a controlled force to a vertebra. It's what you picture going to the chiropractor, popping the bones. This helps to restore proper movement, and movement is healing always. Think about when somebody has surgery. They're up walking and moving immediately. Soft tissue therapy next, such as like massage or myofascial release. That can be used to help alleviate pain and improve the range of motion. And this therapy targets the muscles, tendons, and fascia surrounding the nerve, helping to reduce muscle tension and inflammation. In addition to these techniques, the chiropractor may also prescribe exercises to help strengthen and stretch the affected muscles. I say may prescribe exercises, they better prescribe exercises, right? Stretching exercises can also be beneficial for a pinched nerve because they can cause the nerve to move within its channel, contracting and expanding repeatedly. This is called a neurodynamic move, also known as nerve flossing, and it can make a huge difference for the pains disc patients feel out into their limbs. In addition to manual adjustments and exercises, a chiropractor may also recommend lifestyle changes to help relieve pain from a pinched nerve. These changes may include some of the following. Improving static postures. Poor static postures can strain the neck, shoulders, and nerves of the back. Static meaning sustained, doing the same thing in a bad posture for a long period of time. Next, maintaining a healthy weight. Being overweight can put and does put extra strain on the joints, including the neck and the back. Losing weight can help to reduce the pressure on these joints and the discs in between, and the nerves that run through them. Quitting smoking. Smoking can decrease blood flow to the discs, making it harder for them to stay healthy or to heal from any kind of injury. Quitting smoking can improve blood flow and reduce inflammation in the affected nerve. Reducing stress. Now, stress can cause tension in the muscles and can make it harder for the body to heal. Reducing stress can help to reduce tension in the affected area and can improve overall your chance of healing. And proper back use. Chiropractors should be able to give you recommendations on how to make the best use of your back, especially while performing lifting or manual labor type movement, to help prevent future injury or at least lower the risk of future injury. Now, it's important to note that while chiropractic care can be very effective in treating a pinched nerve, well, it's not a one-time solution, unfortunately. Most musculoskeletal issues are not. It typically requires a series of treatments over time to achieve optimal results. You don't go to the gym and get buff in one visit, do you? A pinched nerve can cause a lot of pain and a lot of discomfort, but it doesn't have to be a chronic condition. If we can catch the pain before it gets to the 3 months period, we can usually do something quickly and prevent it from becoming a long-term concerning issue that's hard to get rid of. If you're experiencing pain from a pinched nerve, it's important to seek help quickly. The right provider can help diagnose this condition, prevent invasive and pharmacologic treatment, and develop a treatment plan tailored to your specific needs that can get you pain-free safely and at less cost. And with the right treatment and care, a pinched nerve can be very successfully treated and the pain can be relieved. If we can help you or one of your loved ones, why don't you call us at 806-355-3000. Let's get to work. If you're watching on YouTube or social media, we'd love a share, a like, a comment. Until next week, I'm Dr. Jeff Williams. Stay smart, stay informed. We'll see you then.